Hi, this is Jackyln Brumwell, and this is my Unit 4 Skills Validation. Today I'll be rooming a patient and performing an ear irrigation. And this is my apartment, showing that it's empty. And that's my mom, Marcia. She's helping me today. This is the rest of my apartment. There's nothing up. And this is the piece of paper with the sample questions for the rooming of patients. So let's get started. Oh, I hate being so nervous all the time.
Right, that's right?
Yeah. Hi, I'm Jackyln, and I'll be your nurse today.
Hi.
Can I have you state your name for me?
Marcia,
And your date of birth?
8/22/62.
Check her wristband. Verify the patient's identity 3 times. So what brings you in to see us today?
My ear kind of feels funny.
Okay, well I think we'll probably perform an ear irrigation. I would obtain the patient's height by having them stand against the wall and get their weight by having them stand on the scale and take their vitals, their blood pressure, pulse, respirations, their O2 stats, and their temperature using a tympanic thermometer. Are you experiencing any pain today?
A little bit.
A little bit?
Not too bad though, but enough to bother me.
In your ear?
Yeah, some kind of itchiness.
And if you had to rate it on a scale of 1 to 10, can I ask you what you'd rate it at?
Oh, maybe a 2.
Okay. Do you use any tobacco products?
Yes.
And can I ask for how long?
About 36 years.
And are they cigarettes?
Yes.
How many packs per day do you smoke?
1.
1 pack? And would you like any information on quitting smoking today?
Sure.
Okay. Are you on any medications currently?
Yes, I am.
And what is it?
The albuterol inhaler.
And is that working okay for you?
Yes, it works fine.
Do you have any allergies?
Yes, I do. Penicillin.
You're allergic to penicillin?
Yes.
And can I ask who your primary care provider is?
Dr. Millette?
And when was your last menstrual period?
About October 13th?
And that's the day that it ended?
Yes.
And do you know when you had your last pap smear?
Quite a while ago. About 2004, I believe.
Okay. And do you know when you had your last mammogram?
Approximately the same time, about 2004.
Okay. So the procedure that we're going to do today is an ear irrigation. And what we do is we fill a syringe with warm fluid and we just kind of gently squirt it in your ear to try to dislodge or clean out the ear canal. Get it cleaned out. You might experience some discomfort or dizziness because the fluid is going to hit the tympanic membrane. Do you have any questions about it?
No, I've actually had this done once before and it works quite nicely.
Okay. So then I would wash my hands and I would lay a towel on the patient's shoulder and I would have them tilt their head towards the ear that I was going to irrigate and I would gently pull upwards and backwards on their, up and back on their ear canal. And using the otoscope I would gently place it inside the ear canal to visualize any of the foreign material or earwax that was in there. And I would have them hold a small basin next to their ear to catch any of the fluid that was draining out of it. And I would use a cotton ball to clean the outside of the ear. And I would fill the syringe with 30 to 50 fluid ounces or 30 to 50 cc's of solution and expel any of the air out of the syringe and have them tilt their head slightly towards the affected ear and pull up and back on the ear canal on the auricle and place the syringe in the ear gently and not too deeply, making sure that the syringe was pointed towards the roof of the canal. And I would gently squeeze the solution into the ear to prevent it from injuring the tympanic membrane and making sure that the fluid could flow freely from the canal. And I would repeat that until all of the solution, or all of the material was out of the ear, or the solution was gone. And I would dry the ear and visualize the otoscope again to make sure that the ear was clear. And I would have the patient lie on their affected side, and so that any remaining fluid could drain out, and hand them a cotton ball or tissue to help them dry off their ear. And I would discard any of the supplies that I used and explain to them that they should report any dizziness or discomfort to the physician if they had any, and instruct them not to insert any foreign objects into their ears. And I would wash my hands, and I would go and document that the procedure was complete, and notify the physician, and also note any problems the patient experienced during the procedure.